Chinese health officials said the rate of HMPV infections in the northern part of China is declining. News of increased respiratory illnesses in China sparked international concerns about another potential pandemic. However, medical experts emphasized that HMPV is very different from COVID-19. Voice of America's Dora Mekouar reports.
China reports that infections of flu-like human metapneumovirus, known as HMPV, are down in the northern part of the country. In recent weeks, reports of rising cases of the virus in the country where COVID-19 began sparked worries of another potential pandemic.
International scholars are calling on China to disclose pathogen information and conduct genetic research to confirm that it is not a new virus. Even if it is an old virus, it could still be a new variant.
HMPV has been around at least since 2001.
It's a very common virus that we see every year. Most children by the age of 5 have already had the disease. It's a virus that will produce symptoms like watery eyes, cough, sneezing, chest congestion.
While HMPV can cause serious illness in children under 5 and in older adults with other health problems, it's usually a mild disease for most people.
It is not nearly as serious as influenza or COVID disease. HMPV has been here for, a long time, has infected millions of people that already have immunity. It's not as though this is a brand new virus that might cause devastating problems.
China health officials say the number of patients seeking medical help is lower compared to the same period last year. Auwerter says the Chinese might be more susceptible to HMPV because China enforced more stringent COVID lockdowns than, for example, the United States during the pandemic.
They stayed home, refrained from work, wore masks. So the usual cycles of acquiring an infection, for example, during the respiratory season of winter, people didn't get infected, so their specific immunity, they weren't boosted. And so there was a larger population that might be more susceptible.
There is no real treatment or vaccine for HMPV. The doctors say any patients who have trouble breathing should seek medical help. Dora Mekouar, VOA News, Washington.